Let me tell you, I come from Pittsburgh. I was born and raised in a little town called McKees Rocks, and my father carried mail on his back. His father was a coal miner, and it was a really pretty tough life for my father and his brothers and sisters and the family. My mother, her mother came from Yugoslavia. She lived with us for a while. She could barely speak English. And it was a very blue-collar Democratic town. In fact, they used to put roadblocks up to keep Republicans from being able to drive into the town. And I decided to make a really important journey 180 miles to the west to a small little school that maybe you've heard of, I don't know, called Ohio State University, okay? And when I got there, I found myself in a dormitory that was 23 floors high, filled with all 18-year-old freshman boys, the first time they'd ever been away from home. And there was a duplicate tower, 23 floors high, filled with all 18-year-old freshman girls who'd never been away from home before. And in the downtown of Columbus, they used to refer to these towers as Sodom and Gomorrah. And it wasn't more than a couple weeks that I got very frustrated with the bureaucracy of higher ed. And my Uncle Emil told me, Johnny, if you want to bring about change, make sure that you start at the top. So I called the president's office for a meeting. And they really weren't letting me in. And so I kept calling, and the same woman kept answering. And she said, young man, you're driving me crazy. And I said, lady, I'm going to have a meeting with the president. It's either going to be today, or it's going to be tomorrow, or it's going to be next week. Okay, she says, come on in tomorrow. So I put my hair up under my hat, put on my best blue jean jacket, and went in to see the president. And it was very impressive. He was a really big, tall guy, deep voice, beautiful office, chandeliers, rugs, furniture. And he asked me what was on my mind, so I lodged my complaint, told him a little bit about my experience. And then I looked at him, I said, sir, I've been in school, about 3 weeks here at Ohio State, and I'm undecided. But when I look at that lady that wouldn't let me in, when I look at the furniture and the carpeting and the lighting and all these things, maybe this is the job for me. What do you do? And so he told me about his fundraising responsibilities, his academic responsibilities, and he told me the next day he was going to go to the White House and visit with President Nixon. And I said, sir, there's a number of things that I would like to talk to him about also. Could I go with you, Hey, if you don't ask, they won't let you in, right? So he said, no, I'm not going to take you with me. And I said, well, if I write a letter, would you give it to the president? And he said, well, I guess I could do that. So I went back to my dorm, and I did a sort of a report on how I thought Nixon was doing. And then I signed it sincerely, John Kasich, P.S. If you'd like me to discuss this further, I'd come see you. I've got time. I'm a college student. So a couple weeks later, I go down to my mailbox, and there is a letter from the White House, the Office of the President. And I open it up, and I look at it, go upstairs, I call home. My mother answers the phone. I said, Mom, I'm going to need an airline ticket. The President of the United States would like to have a meeting with me in the Oval Office. And my mother is shouting, honey, pick up the phone. There's something really wrong with Johnny, So they get me a ticket, and think about this. My dad's carrying mail on his back. My mother's, his mother can't speak English. And I come home after like a month and say, I got to go have a meeting with the president. They think this is nuts. But they get me a ticket. I fly down to Washington. I go to the White House. I get to the gate. I say, hi, I'm John Kasich. I'm here for a meeting with the president. They say, come on in. So I go in, and I'm sitting right outside the Oval Office. And a guy walks up to me, and he says, young man, you're going to get 5 minutes alone with the President of the United States. What do you think? What would you think about that? What would you think about that? 5 minutes alone with the president? Do any of you speak? Huh?
That's awesome.
You would say awesome. What would you say? Yeah, you'd take it, right. How about you? Yeah, I'll tell you what I'm thinking. I came all this way. I have a new jacket, a new shirt, a new tie, and new pants, and I didn't come here for 5 lousy minutes. I ain't coming out. So, right? So So I walk in, they say, Mr. President, John Kasich, the President of the United States. And I sit down at his desk, and the good news is I spent 20 minutes there as an 18-year-old first quarter freshman. The bad news is I spent 18 years in Congress, and if you add up all the time I spent in the Oval Office, I peaked out at the age of 18 and come to school in North Carolina, huh? It's a true story. So I guess from that story to so many other things that have happened to me, I'm free. I've been free all of my lifetime because I'm not in politics or in this business just to try to get reelected. I mean, everybody wants to be reelected. Nobody wants to lose their job, but so what? I mean, that was not my number one priority. My number one priority was to look at problems and try to fix them. Now, I was making a lot of notes and putting a lot of statistics together about all this stuff on Medicaid and all that, and I threw it all away this morning. And I'm going to tell you what happened. So I become governor. I hadn't been in politics for almost 10 years. I had left Congress. I'd had a great career in Congress, and I just quit. And so I was doing a lot of different things. I was working on Wall Street. I'd written some books, bestsellers. I was on some boards. I was in business, and I was at Fox News at the time when, anyway, I was at Fox. So, and then I decided that I would run, and no one who had never run for governor before statewide had ever beaten an incumbent. I think it happened like 100 years ago. So I win. And I inherit a terrible situation. We got about 20% of our budgets in the hole. We'd lost 350,000 jobs. It was a mess. So there was never a better time for fresh air. And I knew really pretty much what I wanted to do. And it's really interesting because when you know what you want to do, and what you want to do has real value to it, it's amazing how people will follow. It just happens. And so one of the big issues that we had to tackle was the issue of Medicaid. It was growing at about 8%, which was the fastest growing item in our state budget. And you have K through 12 education, and you have Medicaid. So I had to get a handle on it. And brought some good people in with some good ideas. And Medicaid in our state was operating in 12 or 13 different entities of the government. And you understand that once somebody has some power, they don't want to give it up. And I said, we're not doing that anymore. We're going to take all of these different programs, we're going to take it out of where it is, and we're going to put it in one place, and we're going to fix Medicaid. So some people liked it. One guy didn't. He didn't work for me for more than a month. He was gone because we needed to centralize it. Then we knew that we had some very big battles coming. One of the big battles that was really, we won, but then I later lost a number of them, was this really crazy idea. Think about this. It's a crazy idea. If you could stay in your home and you can get health care, that you shouldn't have to be shipped to a nursing home. Crazy idea, right? We got to put them in nursing homes whether they need to be in there or not, because our nursing home industry had a stranglehold on the legislature. So I had a massive war with them, which I ultimately won, to give people more opportunity to get health care where they lived rather than being forced into a nursing home. Because when they're in their own home, well, I mean, they're healthier, they're happier, and they have a better chance to be resilient. And it's been working out great. The other thing, we had a whole bunch of health providers, 35 or something, covering all these little areas. And I said, well, wait a minute. What if we just take them all and bid them down and come up with 4 or 5? We can have economies of scale. We can reduce overhead. We can have more competition, blah, blah, blah. So we did. And then I got sued by one of the people that didn't win the bid. And my staff came to me and they said, well, we know the history of this judge, and this judge never rules with the government. And so I said, so what do you think I should do, settle? And they go, well, yeah. I said, are you crazy? Let's take it to the judge, and if we lose, we lose. But we're taking it to the hole here. We're not shooting a three-pointer. We're going into underneath the basket. And we won. And that sent a whole signal through the administration as well. And then we decided that if we had a Medicaid bill we had to pay and it was $1.05, we shouldn't pay $1.07. Crazy idea, you know. Good enough for government, I guess, was the mentality. So we turned our computers on and we started to pay the exact price. And then we decided it was important. I mean, there's a lot of things we did, but then we decided it was important that we combine behavioral health with regular physical health. Now, there's another crazy idea, right? It's like, didn't anybody realize they were connected? And so we started to advance all of that. Then we get this decision about Medicaid expansion. Okay, so the government's going to pay almost all of it up front, and then they're going to reduce it, and ultimately it'll be down to about 90-10. And I'm looking at this thing, and people say about me, because I was really the first big-time leader to expand Medicaid in the country. And they're saying to me, what a hard decision that was. See, let me ask you a question. I can cover 600,000 or 700,000 people, get them health care, give them the help they need so they're not either living in jail or sleeping under a bridge. And this is a hard decision, you know? Now, this morning I was on the phone with an 88-year-old woman who's got COPC. And I called her because her family lives in Ohio. I guess they figured I couldn't call her from Ohio. I don't know why. But since I was in Raleigh and she lives in Raleigh, that I could call her. So I called her, and she was telling me about the wonderful health care that she was getting. And I said to her, do you realize there's a lot of people that don't get health care? And she couldn't hear what I was saying. It didn't compute with her. She said, well, you have to ask for it. I ask for the kind of quality care I get. Think about this. I tried to tell her, but I'm not sure she quite got it. I said, there are many people who live in North Carolina, who live all across this country, that have no health care. So last night, I couldn't believe we went to this place called Death and Taxes, okay? Kind of the last place I needed to go. And I walk in, and this young, eager guy, white shirt, red tie, oh, Governor, you know, I'm a big fan of yours. I said, oh, great. I need all I can get. He said, I work in the Senate. And I'm not going to tell you who or for what, whatever. And I said, you work for a Democrat or Republican? I work for a Republican. He said, you guys going to expand Medicaid? Well, my boss doesn't think we should expand Medicaid. Now, I said to him, do you understand that there are a lot of people that don't have health care? It could be your brother. It could be your brother as he goes through a difficult time. He doesn't have health care, and so my answer to you is no. He said, well, you know, we're really worried about the fact that the government will change the numbers. And I said, well, then why do you take the CHIP program? Which, by the way, I helped create in 1997, because that's a match too. I mean, that's a match, the highway thing's everything's a match. But Medicaid is a match we can't trust. Now, I went to a conference, Koch brothers conference. This was really something. And I was on the stage, and it was Greta Van Susteren, Nikki Haley, Sam Brownback, and a guy from Louisiana, former governor, Bobby Jindal. And so I'm the only one expanding Medicaid. And so Greta starts boring in on me, right? And there was a story that had gotten out, because I was struggling to pass this in Ohio. And I was saying to a major political figure, I said, now, when you die and you go to heaven, St. Peter is not going to ask you, did you balance the budget? he's going to ask you, what did you do to the least of those? Now, hold on. Because this is the opposite of the Koch brothers conference. So this lady jumps up and she says, I heard that you used God against your legislators. I said, ma'am, using God is a very, very bad strategy, okay? Because he can like whack you real quick, so don't be thinking that. I said, but I have to tell you, ma'am, that, and I explained, I don't want people living under a bridge, I don't want them not getting treatment, I don't want them to have health care, blah, 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 blah. And I said, and by the way, there's this new book. It's really, really cool. They took this old part of a book and they put it with a new part of a book and they put it into one book. And if you can't afford it, I'll buy you one. And the entire place started booing me. And I loved every second of it, okay? So there's a couple issues. I feel like I'm so far away from people way in the back. Folks, we first of all, we have to be patient. This is a human justice morality issue, okay? We need to somehow convince these decision makers that it could be your mother, it could be your father, it could be your son, it could be your daughter. You can't not deprive people of health care. And I told this young man yesterday, no, please, let me make the talk. You don't have to, I'm not here to get applause. I'm here to clap. Okay, you can clap. Go ahead. But what I told this young man is, you can't wreck your finances of the state. I said when we expanded, if the federal government starts screwing around with us, we'll withdraw. Because you can't wreck your finances. If you wreck your finances, you can't get jobs, and if you don't have jobs, you have more people in trouble. So I said, just put something in there. Put something in there. Because this is not ideological. I mean, how can, you know what it is like for somebody not to be able to get any care? And if they do get the care, by the way, they run in the emergency room. I don't know if you've ever been in an emergency room. I mean, yeah, well, God bless the people that work there. But it's a tough environment. And then your hospitals, I heard some guy talking about profits. I mean, the reality of the matter is that you can't run a hospital if it doesn't have any money. And the rural hospitals are the ones that are having so much trouble. But because we expanded Medicaid, our budget, by the way, when I came in, we had 89 cents in our rainy day fund. Remember I told you we were like 25% in the hole, we were way in the hole. When I left, we were not only totally balanced and secure, but we've gone from 89 cents in our rainy day fund to almost $3 billion in surplus. And I expanded Medicaid. And our Medicaid program was growing at, 3 or 4%. And here in North Carolina, I don't have the lady's name, but there's a lady who's working on your Medicaid program who's terrific. And you're doing all the things. You don't have fraud. You're moving towards value-based. And this is where health care needs to go in America. Now, I think that most people would rather ask their rabbi or their minister or their priest for how much money they get paid a year than to ask their doctor what something costs. We need total transparency in everything. We need to know what doctors charge. We need to know what hospitals charge. We need to know what the quality being delivered out of these hospitals really is. And I tell you what's interesting. When you put all that on a chart, it is amazing how hospitals will change. And I love the hospital people. They take care of you. But here's what we found. We knew that if somebody went to the hospital for asthma, they were likely to put them in the hospital. They didn't need to go in the hospital. So they looked at their procedures and they said, if you need to go in the hospital, we'll put you in the hospital. If we can treat you on an outpatient basis, we will. And the cost of that hospital plummeted, more in line with everything else. So, and the same is true with with pharmaceuticals. You need to have transparency so we know what things cost. And I was just reading yesterday, because everybody wants to attack the pharmaceutical companies, and I'm like you, I get fed up with them, and they raise their prices, and we think they gouge, and they got these pharmacy benefit managers, and we don't know what the hell's going on. But I was just reading about the amazing amount of research that they are spending to figure out Alzheimer's. And just read about 2 companies that had invested a ton of money, and it's all for nothing. So we don't want to kill them because they're important. They're important if you've got schizophrenia. They're important if you got Alzheimer's. They're important if you've got high blood pressure or diabetes, whatever. But we need transparency so we can see what things cost. So it's with doctors and hospitals. You're doing that here. And the other thing you're doing in North Carolina that I'm reading about, and you're way ahead of us on this, is you're actually beginning to look at areas where you can adjust people's health by looking at it across the board. So you're doing all of these things, and now what's left is to expand access. So I'll tell you what I really believe. First of all, nobody that is yelling and screaming really understands Obamacare. It's become a political weapon, a tool. It's so stupid. Because you could fix Obamacare and still make sure that people could get coverage. That's called an exchange. That's actually market-driven. And by the way, you're also putting people into managed care. We put 90% of our population in managed care, and we're doing it through private health plans, which I'm sure you're doing it here. It's a private enterprise system. What I know about the way the world works is that the public ultimately drives the result. Now, you want to know how to get this passed in the legislature? Put 10,000, you had your thing here when McCrory was governor. They kept showing up every, Friday or Monday, I don't remember what day it was. But they demanded change. How come you don't demand change? Maybe you do. But you need to put 10,000 people out here on the steps of the Capitol. Say, you just have to do it. But before, I wouldn't be threatening. I would visit with these people, and I would tell them, you don't want people to be treated poorly. It's a matter of justice. Secondly, we're not going to let you put the state in the hole. If the federal government, which is capable of unbelievable things, starts fouling around with this issue, you'll withdraw and you'll support it. Thirdly, I think you want to say that, we have this major opiate problem. And you have to have the resources, because what it did is provided an enormous amount of resources for us to treat people. And there's another issue, folks. You know what a serious mental health problem we have in this country? And you know where it exists, a lot of it? In our universities. There's a guy named Marcus Howard. I never met the guy, but I read about him. He's a point guard for Marquette. I think he scored 26 points in the game where they got blown out, but nevertheless, he was a star. And he said he's really proud to be on the Marquette basketball team, but what he's more proud of is the fact that he talks to students, and he's a role model for the fact that in balancing his academics, his sports, his future, all these things, he gets mental health treatment. And he's, to me, that's a hero, a kid that young, being able to understand his responsibility. And you don't have enough money to treat people for mental illness in this, I can guarantee you, because nobody has enough. And these problems are real. So I think in a nice, kind way, maybe with a couple of your ministers, your rabbis, your priests, whatever, your imams, take this message that we cannot leave people behind. And we don't want to bankrupt the state in the process. And it can all be accomplished. And if they have a question, tell them to call me. I'll tell them how we did it. When you go from 89 cents in the surplus to $3 billion, and you're covering 600,000 more people, and our hospitals are more secure and more stable than they've ever been, what's the question? And what's the problem, okay? Now, I'm going to take some questions, but I have a couple other areas I want to talk about. I want to talk about opiates. We were sort of ground zero for opiates, and when I came into office, we had what were called pill mills. I didn't even know what a pill mill was. A pill mill was you just drive up, you get your OxyContin and all this other stuff, and then you go home and you become an addict. And of course, that is what leads you to heroin, all that laced ultimately with fentanyl. This is an unbelievable problem because every time you think you got it, there's something else that emerges. But we shut down these pill mills and we prosecuted the doctors who were there, took their licenses away, and that was the culture that had been created in the state of Ohio. And so that was the beginning of a new day. Then what was most important was to try to figure out why what's the practice patterns of people? Why is it somebody's calling me up and they went to the dentist and they came home and they had 40 OxyContins? I'm like, what the heck? What's going on here? You might remember when you were a kid, some of you are much younger, but some of you are not than I am. Thank God for those who are older. You remember when you got your wisdom teeth out? You go home, you're really miserable. You lay in bed, sleep for a couple hours. Then your mother would bring you some Jell-O or some ice cream. And then you would go to sleep, and you'd wake up the next day, and you were fine. But you knew you had at least a half a day off. And you'd whine about how bad everything felt. I didn't take any OxyContin. This was part of life. So we went and we spent an entire year studying practice patterns. Now, my folks wanted to go early and hard, and I said, no, we gotta check this stuff out. And after a year, we pulled all of the special interest groups in. Anybody who was a prescriber signed up for the rules that I made, and the legislature was fully behind all of this. And we came up with a standard. 7 days on acute pain, no more than that, and 5 days for a child, and no more than that. And then we started to see a change in the attitude of prescribers where more and more, they don't even prescribe that stuff. They're saying, take some extra strength Tylenol or whatever. So what's happened? Well, in 2017 to 18, I'm proud to tell you that we had the most significant drop in dosage. We saw doses drop by 30%, like 300, the number's insane, 325 million fewer doses. And our death from prescribed opiates is at an all-time low. And everybody's involved. And now people around the country are looking to the Ohio model. And I don't know exactly what you have here. Now, if you have chronic pain, we have a different formula. So we work with acute, we work with chronic, and it's been terrific. And now the problem, of course, is the regular drugs, and I don't know who the hell goes on the corner and buys heroin and cocaine, they lace it with fentanyl, and then you die. So we have our law enforcement, instead of worrying about who's going 71 miles an hour in a 65-mile-an-hour zone, they're now busting people. And by the way, keeping their eyes open for human trafficking. Our highway patrol is awesome, fantastic. Local law enforcement, it's working. And so, you know, the idea of treatment, we do treatment. The idea of screening, primary care doctors can have a place to go when they suspect a problem. We've got a long way to go, but it's working. Now, the third thing I wanted to talk about is rural broadband and all this, rural poverty. Bobby Kennedy went around America 50 years ago looking at rural poverty, and it ain't any better today than it was 50 years ago. It is a very vexing problem. Now, I understand every state's a little different, and that you do have rural areas here in North Carolina that are doing well. First of all, if you don't have any health care out there, it isn't going to do well, because people have to be healthy in order to work. They're not going to work when they're sick. But you have areas that have made it, and an area like an Asheville, and I'm not a North Carolina expert, but for some reason, some of these rural communities have made it, while some of them have not made it. Same is probably true in my state. But I want to tell you this one story. About a year ago, the Speaker of the House brought 12, 13, 14-year-old girls to see me in my office. And I listened to them. Their mothers and fathers are in and out of jail. They're all on drugs. I said to them, well, I will just take you out of your home and put you in foster care. Well, you can't do that because I'm raising my brothers and sisters, okay? Now, I guarantee you this exists in your state. So I made a commitment, my staff, we were all together. By the way, we don't have any room in politics today or ever for not to be total team. We're one team. You know, we're one team. We all work together. We don't have silos. Well, I'm done now. Thank God I got out of it alive, and I can tell you this is all true. So we sent a whole bunch of people, and we had all the adults show up. And I said, listen, I'm going to help you to take care of these kids and figure out a solution, but I'm not bailing you out. I'll give you a little bit of money to start, but I'm not bailing you out because this is on you, it's not on me, and I'm going to go away, and then I don't know what's going to happen to you. So what we found is we found a lady who opened up a YMCA. The schools worked with them. The business community worked with them. And guess what? We're up to, last time I checked, about 60 or 70 kids with other counties now beginning to participate. And basically what we're doing is we're putting around these very vulnerable children and frightened children, we're putting around them a support system at the local community of people who are taking on leadership positions. Now, I talked to the people who invited me to come here, and they talked about leadership development, and I could not agree with them more. That leadership development in these rural areas to do what? To begin to understand how to get up, how to stand up, and how to believe and carve out a path for the future that can work. And it's easier said than done. But what we know is that each of these communities is unique, just like every individual is unique. There's never been anybody like you before, and there'll never be anybody like you again. And we don't have to go hit a home run, we just got to go make the world a little better place. And in these rural communities, if we can develop leadership programs, and we can get them to think about those things that work and combine that with the technology of broadband, so we can have distance work and not just distance learning. And we can focus on workforce, which is absolutely critical. If you have a community that is drug-free and has capable workers, people will go to you. You don't have to build a stadium. You just need to build a system where people are capable and qualified. And then we can begin to make progress in rural America, which is a vital part of the heart and the soul of America. I met with these girls after we had been working with them for a few months, and I went down the line with them, and I said, so what difference does it make, what we've been doing? And the one little girl looked at me and she said, well, I don't think about suicide anymore. And so maybe we saved a couple lives in the process, and we can save a lot more. So all I can say to you is do what you can do, rally for the things you believe in, be kind and definitive and insistent on the things that you know are right. Get this opiate thing, this is a simple thing. You just put these rules in and you will see a significant difference. We can work rural poverty together, and that's my story and I'm sticking to it. I've got no more to say except I'm going to take questions. So thank you all very much.